Thank you for listening to Mormon Sex Info. This episode is an archived episode and is only now becoming publicly available. Mormon Sex Info relies on contributions. To contribute, please visit mormonsex.info. And now, please enjoy this episode.
And welcome to Mormon Sex Info. This is Natasha Helfer Parker, and today I'm so pleased to have with me Dr. Neil Cannon. He has a PhD in human sexuality and a postgraduate certification in marriage and family therapy. He is a AASECT certified sex therapist and supervisor of sex therapy and has a private practice in Denver, Colorado. I just have had many positive interactions with you through AASECT and so glad to have you on the program.
Well, thanks. I'm really glad to be here.
Great. Is there anything you would add to your introduction?
Well, I would just add for you, which is, I've known of you by reputation for a really long time, even before we, actually got to start working together and interacting. And I think that the work that you've done in the LDS community for a really long time is just beyond words in terms of being valuable. So I'm just grateful for you. So thank you for having me on.
Wow, thank you. That's a real honor. And I guess we'll start off by just saying that you're one of my guests who is not LDS. So I usually try to have a good mixture of both, but I also know that you're fairly aware of issues surrounding LDS population and kind of familiar with our faith and belief structure. So anyway, I think this will be a really good fit. Today we're going to be talking about erectile disorder, and part of my goal with these podcasts is to have some really very specific information and helpful information as far as understanding what these terms mean and understanding what goes into them and resources for trying to help those who might be struggling with some of these issues. So let's just start off with kind of a definition. What is erectile disorder, and what falls under kind of maybe more normal ranges and more disordered ranges, and what does that even mean?
Yeah, so erectile dysfunction or disorder, and we'll just probably refer to it as ED, so I don't slip over my own tongue for the next hour. It is just simply when a man is unable to either get or maintain an erection that is hard enough and stays hard enough for intercourse, for penetrative sex. And it's really common. I mean, I guess that's one of the things I'd really like to stress is it's way more common than most people realize because it's not really dinner talk for most people. We can talk about sports and faith and all these things, but not very many guys want to say, "Hey, I didn't have an erection last night." So I want to normalize that piece. So the math is that 40% of men that are age 40 and older will have and have been affected by ED at some point in their life. 50% of men 50 and older have had ED, 60% of 60-year-olds, and so on it goes. So the older we get, the more common it is. But that doesn't mean guys in their 20s and 30s don't have ED sometimes too.
Yeah, and right off the bat, that just kind of reminds me, I know that I'm kind of known for saying that, sex, we can expect for sex to get better as we get older. And yet I think this is one of those things that often attacks that notion, right? Or gets in the way, that people expect that, as we get older, our bodies will fail us. I won't be able to have an erection, so I can expect my sex life to decrease. And maybe we can talk about this a little bit later as well, but can you speak to that issue between, obviously our bodies age and we have issues as we age, but does that have to be correlated to quality of sex?
Well, no, I mean, you're right. We can have wonderful sex regardless of our age. And I think it looks different at different stages of life. And so couples that are really intentional in their marriage and have a high value on sex and intimacy are able to create and maintain that kind of connection for their entire marriage.
Yeah, thank you. Okay, so what's the difference between, maybe having somebody diagnosed with erectile disorder versus having an event where an erection doesn't occur?
Well, for me in my practice, I don't really think about things in terms of diagnoses, right? Because I really view all this as a strength based approach to help people deal with whatever it is they're dealing with. And if there's insurance involved, then yes, certainly we need to have quote a diagnosis. But at the end of the day, what we're really trying to just figure out is what's going on for that particular couple and what do we do about it. Um, if somebody has an event, I like that word, an event. If somebody just has an event, right, and they just don't have an erection one night, well, that's just kind of normal. That's just part of being human, and it happens. And to just kind of dust ourselves off and make sure we're really kind and gentle with each other in that moment, and we're supportive, and we have still make it a good sexual experience, whether or not there's an erection. And if it's continues on though, to your point around, diagnosing and when is it a problem, if it continues and it's an ongoing thing, and then we want to get to work on it and see what we can do to make the matter better.
Yeah, I really appreciate that because I think that this is such a, I mean, you're hitting on some really important themes right off the bat, which is how do we define successful sex? And I think most people expect successful sex to include, an erect penis. And so therefore, if that's not happening, then it can kind of put a damper on the whole experience instead of realizing, hey, we can maybe still have a successfully sexual experience without an erection, and what would that even look like? But then secondly, too, is this idea that just because it happens once or twice, you don't need to label yourself as, oh my goodness, I've got ED, and so kind of to your point, the spectrum of normal experiences as we go through life, that sometimes things work the way we want them to and sometimes they just don't, and that's perfectly okay. So let's get into this, why this might happen. Why is sometimes ED an issue? What are some of the causes that go into play here?
Yeah, so I always think about it's either going to be physiological or psychological. And so, when I hear about a man who has ED, so the very first thing I really, really want to make sure of is, the penis is a kind of a barometer for the cardiovascular system. So, like my little yellow flag is going off on my head, and I'm like, I want to make sure that this fellow is physically checked out by a medical doctor, so that we make sure that there's no cardiovascular problem looming. So that's like the very first thing, just safety, health and safety. Um, and there's lots of physiological things that could be in play, but that's the one that's always, the most concern for me. And then the second part, of course, is psychological, right? And I would say that probably 80 to 90%. I probably treat my practices pretty diverse, right? I treat everything: women's sexual health, men's sexual health, um, anything that has. I don't take new clients if it doesn't have to do with sex, and that's pretty much all I do is sex therapy and couples therapy related to sex. And so I see probably 2 to 4 guys a week. Then that's their reason for being in my office is because of ED. And I would say that 80% of those cases is psychological, and it's usually related to anxiety and somehow being in their head and thinking about failing. And when we start to think about failing, we can make that come true if we think about it enough.
And would you say that's the case regardless of the age factor as well? Because I wouldn't necessarily, like you said, erectile dysfunction becomes more prevalent with age, but does anxiety become more prevalent with age?
I'll tell you what happens is once a guy has ED and he experiences that, then he starts to think about it, and then he starts to worry about it. So the more ED he experiences, the more he thinks about it and worries about it, and then the more ED he has. So kind of in a secondary way, yes, with age it increases, and some of that is physical, but some of it's also psychological.
Okay. So, since we're going to probably spend most of this interview talking about the psychological aspects, let's get some of the physiological aspects out of the way. You talked about cardiovascular health. I know another common one is diabetes. What other maybe physiological things would you say go into that you want to make sure kind of checked out for?
Could be neurological. It could be physical trauma. I mean, those are the most common.
Right.
And
And even like maybe interplay with medication, correct? That
oh, sure. So, it's really we we have a culture where there's a lot of use of um, antidepressants and anti-anxiety medications, and a lot of other classes of drugs too. Um, Cancer medicines, for instance, and all these things can cause erectile dysfunction, um, and as can things like alcohol and actually too much tobacco over a long period of time. So fortunately, those things aren't things that most LDS people have to worry about, but it does occur.
I'll take you on a quick tangent here. What
Okay.
about what about pornography use? There's been some talk about that being tied to ED at some level.
So the deal with pornography and ED is if people use porn, men, let's go back to men. If men are using porn um, for long periods of time, and by long periods of time, where I see it show up the most would be, let's just say somebody starts looking at porn at age 14, and now the same man is 34. Now we got 20 years of porn and masturbation, and um, it's really easy to train the body to respond to certain stimuli. And so the body has a great memory. And so it can play a role. I don't think there's the kind of ED that kind of makes it to some websites where, um, you know, porn is made to be the actual culprit that sometimes some of the language on some of the websites actually make it to be, but it can be problematic. And so if somebody is looking at a lot of porn, or whether they're looking at porn or just masturbating a lot, I always ask my guys to, when we're in the process trying to resolve your ED, let's focus 100% of your sexual energy on each other for a while and see if maybe that can help you as you're trying to resolve the ED piece.
Okay. And when you talk about a lot, because again, talking to a Mormon audience, there's not a lot of I guess acceptance for any porn use or any
Uh-huh.
masturbatory use, and so it can be very easy to say, well, you looked at porn 4 times last year, so that's why you're having, ED, or wondering if those things could be playing. So I'm guessing what you're talking about is a pretty regular habit, so several times a week, or even a day, is maybe more what you're referring to.
Yeah, thank you for clarifying that. So, yeah, I think from a sexological perspective, there's all kinds of faith reasons to not look at porn. Got that. From a sexological perspective, somebody who looks at porn 4 times a year, to use your example, that's not going to cause ED. Somebody who looks at porn and is masturbating for 10 hours a week for 20 years, that could impact what we call the refractory period, which means it's the time that from a man, from the time he is erect and has an orgasm and ejaculates to the time that he can get erect again is called the refractory period. And if somebody's masturbating, you know, 10 hours a week or 20 hours a week or 3 times a day or whatever it is, it just affects the refractory period. That's just a fact.
Right. Okay, great. And I know I've heard too people talking about like, could my testosterone levels be affecting EDs, or are there hormonal issues as well that might be a good idea to get checked out, or
Yep. So my preference and my process is always when I've got a guy in with ED, I really like to take a two-prong approach. And the first is to while I'm starting to do the psychological assessment and the relational assessment and trying to understand the person, the whole person, I really want them to go see a really good urologist that specializes in men's sexual health. And that's really different from a urologist, for instance, that works on cancer or works on does predominantly vasectomies or whatever that person's specialty is. So if they were really specialize in men's sexual health, they're going to check testosterone, they're going to check free testosterone, they're going to really do a really solid workup and the cardiovascular stuff that we talked about, so that we're going to have a really good sense for is there a physiological piece here at play. Because once I've got that as a sex therapist, then we pretty well know what to do psychologically, but we do have to understand the physical piece. And testosterone's can play a huge role in erections and desire. And if you don't have a lot of desire, that doesn't help with your erections.
Right. Right. Okay, good. So let's move then towards kind of just looking at this from a quick life cycle perspective. I know that for some men, I think for all men, this fear of ED at some point of their life starts taking a role.
Yep.
And but I think that even for some men, there's even this fear of being able to perform like during their first sexual act. So this would happen quite young. So whether, we're teenagers or young adults, it seems like there's, for a smaller amount of percentage of men, that seems to be a fear. Is that your experience, that fears of erectile dysfunction right from the start can be a problem versus maybe what you were describing earlier, which is later on in life it becomes an issue?
Yeah, for guys that are in, let's just say we've got a young married man and he's 22, for instance. Fear can certainly play a role, and in the LDS community, the practice is to not have sex until they're married. And so now all of a sudden, that just is, there's a lot of anxiety, right? Now it's the first time for all kinds of new experiences. So for some men, certainly they can experience ED at a young age. Most of the time, however, the body takes over, and an erection is a natural result of arousal and relaxation and the feeling of connection to one's wife. And so, generally speaking, the body works, and young men don't have erection problems. But that doesn't mean it can't happen, and it doesn't mean it doesn't happen.
Okay, thank you.
Yeah.
So,
Could
yes.
while you're on that, could I just add one more little thing? Because you
Yes.
talked about life cycle, and before we get too far away from that, I think it's really important for people to also know that there's a real myth in our culture that it's women that are older women, kind of postmenopausal, that tend to be the reason why, or perimenopausal, and it's the woman that's shutting down and not having sex. And that can certainly be true. But one of the leading reasons that couples stop having sex when they get to their 50s and 60s is that because the man's fear of ED is so great, he is the one who withdraws because he would rather not have sex than take a chance of having ED and feeling bad about that. The shame and embarrassment.
Right, right. Yeah, that is surprising to most people, I think. It was surprising to me when I heard it.
There's a really, really good movie called, it was with Tommy Lee Jones and Steve Carell. If you can help jog my memory on that. Hope.
Yes,
Hope.
yes. It was
Hope.
and Meryl Streep, right?
Yes. Is it Hope? It's not Hope Floats. It's Hope Springs.
Okay.
And that's a great movie that just gives a really good example of how men do withdraw. And you can just watch it with this couple. It's really good.
Yeah, and oftentimes I also notice just kind of in the life cycle, as a couple, oftentimes, pregnancy and children and all of those issues for women that are happening earlier on when they're maybe withdrawing sexually And then they finally kind of get to a space where it's like, oh, I can reclaim myself and start enjoying this part of my life again. And then that's maybe when the man is withdrawing. Is that a pretty general?
That's perfect. Yeah.
Yeah. Okay.
Yeah. Also.
So, I guess let's go right into that then. What are some of the messages or psychological reasons why this is such a big deal to begin with? I mean, I think that we spend a lot of time, at least in podcasts I've been on, and talking about Mormon women, about all these messages, that women get as far as how they're supposed to look and how they're supposed to act and, what makes a successful woman. But sometimes we forget to talk about all the messages men get, and what it means to be masculine and what it means to be, virile and sexy and just expectations, I think, that not only Mormonism, but our general culture puts on men, as far as what it means to be a successful spouse and a successful lover and all these things. So why don't we start there with some of the maybe psychological aspects that you think go into the messaging that people are struggling with?
Sure. So, I watched the James Bond rerun the other night, and I watched, it kind of gets to the point where James gets the girl, and, I thought to myself as just kind of watching and enjoying, but I also kind of went to this place of being a sex therapist for a moment. I thought, I'll bet you James Bond never had ED.
Right.
And,
right. That's the epitome, right? James Bond is the epitome of the masculine message.
Right. And it's just it. And so what we, as a culture, we get ingrained with that this is what men look like. They're trim and they're fit and they have guns and they always get the girl, and then when they're about to move in, the music starts to play, and I'm sure that every time when James is involved, there's probably simultaneous orgasms and stars go off and everybody's toes curl each and every time. And so that's how we get our idea about sex. And it's just, of course, fantasy. It's not what real sex looks like for real couples. For real couples, sex is toe curling, great, awesome sex. This is for couples that are in long-term marriages. Toe curling, awesome sex 10% of the time. And then 2/3 of the time, it's pretty good. It was connecting. The couple's glad they did it. Probably at least one person had an orgasm, and they're like, hey, this was really, lovely experience, and we feel more connected now. And then 25% of the time, something doesn't work. There's either pain for her or there's some kind of sexual functioning issue for him. And that's the reality of being in a long-term marriage.
Yeah, so helpful to have realistic expectations, right? Versus, I think what sometimes and then when you have those expectations that the toe curling is supposed to be like 90% of the time, then how devastating that feels, that we feel like failures and either there's something wrong with me or there's something wrong with you, and we get into these blaming stances and how damaging that can be.
Oh, I'll never forget this lovely couple I worked with many, many years ago. And I kind of explained that, and he had withdrawn from sex because he was so afraid of ED. And when he literally is walking out my door, he had his hand on my doorknob. Us therapists call that a doorknobber. He had his hand on my doorknob, and he turned around and he looked back at me and he said, "What you said a minute ago about that?" He goes, "That just changed my life."
Wow.
Yeah.
Yeah, that's significant.
So we have these cultural messages about what sex is supposed to look like, and we place a really enormous value as a society on intercourse. That's the end all. And if there's not intercourse, then for a lot of couples, they don't view it as real sex.
Right. Yeah, it was interesting that you mentioned, fit and trim, that men really have a lot of body image issues as well, that there's a lot of messages about what it means to be an attractive man, to be desirable by your partner. So if a man isn't feeling good about himself physically, or maybe hasn't been exercising as much, or things of that nature, that can really take an effect on how he feels about himself.
Sure, and hair. right? Think how many men even feel like if they don't have a full head of hair, that they need to take medicine to fill out their hair. And unfortunately, some of those medicines actually can be problematic related to erections. So it's kind of learning to just love ourselves for who we are, the way we are. And that's what makes the best sex partners. And that's what makes for sexy sex partners.
I love that. Sexy sex partners. Okay, I'm stealing that from you. Anyway. All right. So I think we're getting into some of these themes, right? Like low self-esteem, maybe having low confidence, how masculinity is defined, which can really be problematic as far as gender norms and things of that nature. I know in Mormonism, we do have a lot of that. You know, the male is expected to be the provider, is expected to, in a sense, kind of be the patriarch of the home, which, you know, that's becoming more egalitarian, I think, with time in our culture. But at the same time, I think this sense of being a leader and being a protector of the home, so that's a lot of pressure. And for example, I've noticed high correlation if somebody's lost a job or is struggling, you know, in some of those roles that they're supposed to play, that can be a real, I guess, killer to their sense of masculinity.
Job loss is really tough on men. Um, because you're right, it does identify a lot of men as to who they are as people on the planet. Um, and there's other external stressors that can affect erections and libido and everything related to sex. Things like, family stress, stress with the kiddos, not even losing a job, but just being stressed at work, having a household that's chaotic. Um, all those things can really impact a man's sexuality. Women's too.
Yeah, for sure. Okay. So how, and then, well, just to keep on before we get to the how-tos, some other things I think too are just, and I think you mentioned this kind of the relationship distress or quality of the relationship. So I've heard this once. It's like, it's one thing to not be able to have an erection, you know, maybe more due to physiological issues, but it's another thing about who you're having an erection with. And so that can sometimes play into it, that, you may physiologically be able to, but due to whatever relational issues are maybe happening, that's becoming a problem in your relationship.
Yeah, there's this thing that happens, and I always feel a lot of compassion and pain when I see it unfold, because men do it to women and women do it to men. They just do it different. And I'll see women who will send their husband to my office to get fixed. And I don't like that any more than I like it when a man sends a woman to my office to get fixed. And so the way I always kind of think about it is, look, there's like three circles when I'm assessing somebody for ED. There's the inner circle. If you kind of think about this like a bullseye, there's the inner circle, and that's the genitals. There's the next circle out, and it's the whole body, the whole self. And then there's the third, the biggest circle on the outside, is what you're talking about now, which is the relationship piece. And if being sexual and having sex takes a lot of vulnerability. And if we don't feel fully safe emotionally with our partner, it just might show up in not having a great erection, or not being able to get an erection, or not being able to keep an erection. And so how do women show up in ways that make their male partner, not feel safe? Well, if a woman's critical, if a woman's blaming, if a woman is contemptuous, I'm a little better than you, looks down at the man for some reason, all those things, those are all common. I'm not like making these up. These are things that actually happen with couples. And yeah, it shows up. His body responds and says, I don't feel safe enough to be hard with you. I'm out.
Yeah, and that's often, I mean, that's not a conscious response usually, right? That's a very subconscious or unconscious
Oh, he's willing,
response.
he's begging, he's praying that he's hard,
Right.
right? it's not to punish her. It's shameful for him to not be able to be hard, but he's so afraid that if he's not hard, will she cry? Will she be hurt? Will she be mad at him? Will she send him off to a sex therapist?
Right. Right. Yeah, that would be an awful thing to go see a sex therapist like us.
Yeah, right? And
Right. But it is. I mean, oftentimes it's a very shameful, taboo thing to have to go see somebody who specializes in these types of things. That actually means something really is wrong, or that I have to admit something is wrong.
yeah, I mean, there's a lot, for you and I as sex therapists, it's really easy to forget how hard it is. Not maybe not for you, but for me, it's easy to forget how hard it is for some people to talk about these things, to the point that with like a man, I've had lots of men who've had ED issues, and they're afraid to even ask their GP for Cialis or Viagra or anything in that class of drugs, because they don't want to talk about it. They don't even want to admit it to their GP they've been seeing for one time or 10 years.
Sure. Yeah, and I think, going back to the messages, especially, I think that, I mean, this is really a program about men, so we're making it about men. We're not saying that men aren't also contemptuous or
Right.
shaming of their wives, but this is what we're focusing on right now.
Right.
But I think that some of the messages that I think Mormon men get oftentimes from their overall Mormon culture, and then of course their wives are programmed to think this about them, is all you care about is sex. You're going to want sex and I'm going to have to give it to you. And so a lot of times what I see in the early parts of a Mormon marriage is a woman still feeling like she has to somehow be a gatekeeper for her sexuality, and the man is shamed in the sense that he even wants sex to begin with. That if you were more spiritual or more worthy or more in tune with, what God would want, this wouldn't be as important to you because it isn't as important to me, right? And so these are libido kind of classic differences, especially through pregnancy and childbearing and all those issues that are very common. I think that takes a toll for men. And I often hear from men this sense of, I've been initiating for over 20 years and getting continually rejected. And that plays a big, because men, we know through research, have very similar desires to women, right? I want to feel wanted. I want to be desired. I want to feel sexy. I want to, have a good sexual experience. I want to love this person I'm with. I want to be loved by this person I'm with. So it's not that different, but libidos sometimes are different. And, but do you see what I'm saying as far as these messages that men get that really shame them as to being sexual creatures to begin with?
Mm-hmm. I think you're spot on. And so I think that, one of the ways we like couples to think about sex is that when you got married and you got married in the temple, you signed up for monogamy, and you signed up for, and implicit in that is that you signed up to help each other get 100% of your sexual needs met from each other. And so with that as your contract that you've created between each other, then how are you going to do that? We don't always all get what we want when we want it. But when it comes to sex, you are really, really relying on your partner, your spouse, to be there for you. And I'm going to shift gears just a little bit here in terms of the ED piece and just talk about gender differences for a minute, which is, look, there's this notion in our culture that it's always the man who wants more sex. And that's just poppycock. I
like that word too.
I think it's in my office, I'd say it's about 60% of the time. So libido, gaps in desire is the number one reason couples come to sex therapy. We know that. And I would say 60% of the time, it's the guy who'd like to have more sex. But 40% of the time, it's the woman that wants more sex. So when we talk about gaps in desire, we're not just talking about gender and men. We're talking about people. And when it comes to men and ED, to bring it back to that piece, you're just absolutely correct. And the messages we give our men to try to control their libido and temper their libido does not help It's just not help how anybody have good erections.
Yeah. No, I agree. And yeah, that's a lot of the work I do with Mormon couples too. You know, your point about monogamy and we've part of our marital contract is that our sexual needs get met only in this space. It's a whole nother podcast, but I work with couples around tools around that. You know, like, yes, that's true, but there is some nuance there, you know, using masturbation or the types of sex or, you know, things of that nature. Because I think that really can put them both in this really kind of catch 22 of I either have to sell myself short or I have to sell you short. and and I don't want to do either, right? And so how do we really create spaces where neither need to get sold short just because there are libido differences or things of that nature? So
Right.
really...
Yeah, we want to take it out of a zero-sum game. And one of the ways to do that is by expanding the definition of sex, which is what you've done. And you've said, look, sex is more than just intercourse. So the bigger we make the definition of sex, the more sex couples have. The smaller the definition, the less sex they have. And so if the definition of what sex is becomes big enough, then it's a lot easier to help couples close the gap in desire. And I like to remind people too that, it may be, I'm never going to tell a couple, anybody in my office, they should have more sex. What I invite them to do is think about, well, what are there consequences here if you don't figure out how to close this gap?
Right. Yeah, great. So talk to us a little bit about how you work with some of these psychological factors. You know, you mentioned about 80% of the ED issues that come into your office have some psychological component to them. So what are some of the things that people can find useful in doing the type of work that somebody like who's trained like you are that would do with somebody?
Mm-hmm. Well, I mean, I like for people to understand when it started. That's really important. And does it happen all the time or just some of the time? Because if we own our bodies, and nobody knows our own body like we do. But not everybody really recognizes until they come into our room, like, when did this really start? And when we understand that piece, it kind of helps us to start to unravel the puzzle and solve the problem. And are there any things that explain why there's ED? So we kind of want to understand that piece. And we want to understand things like, is it only during intercourse, or is it during masturbation, or is it mutual masturbation or oral sex or whatever, right? All those things give us clues that we can then help our clients try to kind of figure out what do they do with it. Mindfulness is a term that some people really know exactly what I mean when I say that, and of course other people really don't have any idea what we mean. So, mindfulness is just to be able to be present and be calm and be in touch with our mind, our heart, our soul, and that's a really big part of helping men be responsible, not be responsible, but to own their own body and enjoy their sexual pleasure.
Right. Instead of focusing so much on whether one part of their body is functioning the way they want it to be more, I guess, to step back more into the overall experience.
Mm-hmm.
Yeah. And coaching, I think, the wife too, in this regard, right? That just because all of a sudden, the penis goes soft or something like that, that doesn't mean that everything has to stop, that lights go out, we turn our separate ways. Like we can find different ways to pleasure or continue. And I'm guessing a big part of what you do too is just that ability to communicate. I don't think couples know how to communicate about that stuff. Nobody's teaching people to talk about these kinds of things when they're happening.
Right. And, you talked about the wife and trying to help her understand this piece. It also doesn't mean there's something wrong with her. It doesn't mean he's not attracted to her. It doesn't mean anything other than the fact that he doesn't have an erection right now. And I love how you said, things don't have to stop. People have great sexual experiences without erections. Remember, there's an entire population of people with physical disabilities that can physiologically not have an erection. They're not ever going to have an erection, but that doesn't mean they don't have great sex. That doesn't mean they don't have great orgasms. That doesn't mean they don't have lovely, intimate, and connecting marriages. So,
Right. Right. So really getting away from this defining of the erection as pivotal for the sexual success of an encounter together. I mean, that's really what we're talking about.
right. As soon as an erection, it's not important for most men, and it doesn't matter if he's hard or not hard. That's the beginning of being able to be hard.
Yeah, that's great. And I loved what you said about the woman not making meaning that is not attributing meaning that may not be there at all. Like, I'm not attractive, or is he thinking about something else, or he's not into me, or he doesn't want to be doing this.
Right.
Again, we assume a lot of things, and you know what they say about that.
Yes, we do.
Okay, well, great. So, anything else that you would say as far as helpful techniques? Or, I mean, I know we could even get into some of the more medical things that are out there as far as actual options for intervening more medically.
Sure. Well, on the psychological piece, so we've got the mindfulness piece. Hypnotherapy is a great tool for ED. Um, there's a lot, and so there's two ways to do that. One is to go to a hypnotherapist, certified hypnotherapist in your community that you're comfortable talking to and you can get support from. The other is you can actually go to my website, and there I have what I found is hypnotherapy works really well and really helps men. But the problem is most guys don't really want to go to a hypnotherapist and tell their story again, and it's expensive too. Hypnotherapy is like, in Denver, I don't know what it is, around the world, but in Denver, it's like $250 to go do a hypnotherapy session. So we've created a series of like 20 different audio hypnotherapy recordings. They're about 20 minutes, and there's actually one specifically for ED, and they're only $39. Guys can download them instantly on their computer and listen to them at night before they go to sleep or before a sexual encounter, and it just really helps speak to the subconscious. So that's another psychological thing.
Great, and I'll make sure to link to that because I would love to, further anything that you've developed on this for sure.
Yeah, it's really helpful. I've had lots of great successes with it, but I remember I had one man in particular who really, really struggled with ED, and we kind of pulled out all the stops and we tried all the things we had available to us. And what he came in and reported to me was that, of course, that we were able to treat his ED and he was fine. But he reported to me that the hypnotherapy actually helped him more than any other thing, including Cialis.
Including what? I'm sorry.
Including Cialis. It helped him more even than medicine.
Oh, I see. Right. Yes. Right. Yeah. No, the mind is a powerful thing for sure. I mean, this is what we're getting at. Even though there's physiological components, that doesn't mean that it's not interwoven with how we respond to it.
Yeah. And one of the things I think that men can grasp, if you can grasp this as a concept for sex, this is the umbrella to having ED not be an issue, which is, and there's other penis issues too, and this applies to all of them. Like there's delayed ejaculation, and there's premature ejaculation, right? Those are the three most common with ED. And the umbrella for all that is to focus on the pleasure, not the performance. And if you just stay focused on the pleasure, enjoying yourself, enjoying your partner, and all those things that go into that energy, then again, erections kind of tend to take care of themselves most of the time.
Yeah, so with that, because you had mentioned anxiety before, so many things that can be directed towards that, such as breathing exercises. You mentioned mindfulness, just even cognitive behavioral work, right? Like learning how to change your inner dialogue. In those moments when you're having that anxiety, your inner thoughts and talk can be quite pervasive.
Yeah. And there's mental health issues too that play out for ED. So we know that, that you mentioned the anxiety just now. Well, we know that guys who have ADD, anxiety, depression, OCD, sometimes PTSD, some of those things, we know that rates of ED are higher when those things are in play. And so we have to make sure we're treating, the mental health piece of this too.
Yeah, so there's this interplay. There's not just a lot of times we just want one thing to be wrong, but obviously there's a domino effect as far as things that and what comes first, the chicken or the egg, and so it's this complicated kind of we're not just one thing.
Yeah, I mean, if you're ADHD and you're looking at the spider crawl across the ceiling, and then you're thinking about work, and then you're hearing noises, I mean, that's hard to just relax and be present and focus on pleasure.
Yeah, exactly. Really good. Yeah, and you mentioned PTSD, which yeah, any past trauma we know also there's I mean, a big part of surviving trauma is learning how to put walls up, not down. And sex kind of requires us to put walls down, right? And so,
You bet.
yeah.
Yeah. And, and exercise is huge for guys with ED. One, it raises testosterone levels naturally. But two, it makes men feel better about themselves. There's a huge psychological component, kind of back to your conversation around masculinity, that goes with exercise. So that's one of the first things I really try to get guys to do if they're struggling with ED is let's get that cardiovascular system firing 4 times a week for 30 minutes or so. It can have a big impact.
Yeah. Plus, it helps with depression and anxiety and a lot of these other things, right? So,
Absolutely.
yeah, great.
And the other thing too is we want to make sure that our erotic interests are being honored. So whatever that is for each married couple, both for he and for she, um, is the couple able to, you said it's kind of hard for couples to talk sometimes. So are they actually able to talk about their peak erotic interests and doing the things that turn each other on? That's a really important part of it too.
Yeah, and that gets pretty complicated because if you're turned on by something I'm not turned on by, well, then what? Or is that a threat, to me? Or is that a threat to our marriage? Or
Hmm.
again, do I need to sell myself short to keep you happy? So these are all the anxieties that I think come up about not knowing how to, well, first of all, if just because you're talking doesn't mean you have to do anything.
Oh, thank you for saying that. Right, because that's what happens with couples sometimes, is they get in this place they're afraid if they talk about it they'll have to do it.
Right. Yeah, and then if I want to try something that maybe I'm uncomfortable with, and then going back to the religious aspects, is this even okay for us to be thinking about this? I know that there's a lot of not just about what you do, but what you think about that can be considered sinful, and
Hmm.
so then that puts a lot of, I guess, limitations on what couples might feel free to explore.
Hmm. And and everybody has their own interpretation of the Bible and the Book of Mormon and everything else that has to do with faith and religion, right? I can sit with a couple and they can both tell me they're LDS and they can have really different views on what that means. And
Especially in the sex department. Yes, I
right?
absolutely agree with
And
that.
and so without the conversation, then they're kind of trying to read minds. And so that's why I think, to your point, the conversation is so important. If you think it'd be helpful, I can give you like a really good, simple exercise couples can actually do on their own.
Yeah, let's do it.
So it's simple and it's fun. I call it always, sometimes, never. And so what I ask the couples to do is, let's just have a couple date nights here. And on the first date night, go out to dinner, get away from the kiddos, no conversations about tasks and to-dos and children, and just this is about each other. So let's get into that space energetically to begin with. And bring a journal or a pad of paper, however you want to do it, and just make we're going to brainstorm. The first part of this exercise is just a brainstorm. And together, make a list of the sexual things that fall within your belief system, within your faith, what you think is like okay. So that might be things like, well, it's okay to wear lingerie. And then if then that's okay, then what kind of lingerie would we be thinking about? Well, red lingerie. Let's put that on the list. Again, this is not a negotiation. This is brainstorming. So just saying it doesn't mean we're going to do it. And then you might say, well, what else could we put on the list? Well, it's okay to kiss. It's okay to French kiss. We're married. How do we feel about oral sex? Okay, let's put that on the list if we feel like that's within our bounds of our faith, and so on and so on and so on. So essentially, you're creating a list of behaviors, places, like is it okay to have sex on the beach? Is it okay to have sex in the backyard in the summer when the kids are gone? In a tent or not in a tent, depending on where you live. Right? So we're just making a list of the things that we think are okay. And we're doing those in a really careful, sensitive way without judging each other. We want to be really accepting. And it's one thing to say, I don't think that falls within my faith. I don't feel comfortable with that. That's fine. What we don't want to say is, hey, you're like creepy for thinking about that. That's not okay.
Right.
So there's the first part of the exercise.
And so are you saying that only the things they both feel are okay go on the list?
Yeah,
okay.
In terms of just being okay spiritually.
Right.
All right. So we get those on the list, and hopefully we come up with a list with lots of things, different things we can wear, places we can be sexual, things we can do, right? The bigger the list, the better. That's night one. By the way, that often ends up in the couples going home and having really nice sex.
I hope so, yeah. Other than, what you said before, like, how could you even think that? So now I don't even want to look at you. So yes.
And then the second part of the exercise is another date night the next week. And now we're going to each have our own pad of paper or our own journal, and we're going to make 3 columns. And we're going to take every single thing from that first night, and we're going to put it in a column on our sheet. He's going to put in a column in his sheet. She's going to put it in a column in her sheet. So let's take kissing. Okay. We both agree, I love the kiss. So I'm going to put that in my always column. And he does the same thing. So now we got 2 things we can always do. We can always kiss. And then we're going to say, you talked earlier about masturbation, and so we'll put, you can, if you're horny and I'm not, sure, you can always masturbate. Let's just talk about it so I kind of know what's going on, or whatever it is. Let's see. You said on this first list we put together, you said blindfolds. You're like, okay, I'm okay with that sometimes. So I'm going to put that one in my sometimes column. And then you said we had on our list that we wanted to pinch me. I don't really like to be pinched. So let's put that on. That goes in my never column. So by the time we're done, we got all these things in our always column and our sometimes column. And those are the ones we focus in on. The nevers are never for now. Doesn't mean never forever, but they're nevers for now. And we just focus on all the things that we can do. Things we find erotic.
Well, one thing that you said there at the end that I love is it doesn't have to be never forever. In other words, these what you're describing very well here is kind of coming up with a sexual contract, which none of us have been taught how to do. And so we have a lot of assumptive, sexual contracts out there kind of in la la land, but this is a more actual sexual contract. And that they can be re-explored and renegotiated with time, right? So something that I thought I might be willing to do, and we've tried it 10 to 15 times, and I realize I really hate it. Or something I thought I would never want to do, and now I've kind of had a reframe on that, and so now I want to, try it sometimes. I used to love this, and I thought it was on my always column. Now I don't love it so much. So that whole renegotiation process, this is something we can revisit every 6 months, every year, or just whenever we feel like it.
Yeah. Absolutely. Perfectly said.
Yeah, I love that. That's great. All right. So see, that was worth the download right there. Was you just got a great, a great sex therapy technique. So let's talk a little bit then about medical intervention, some more, I guess, invasive approaches.
Hmm. So, we know that um, Viagra class, Cialis class of drugs are the kind of the least invasive medical intervention. Not a lot of side effects. Lower doses. The lower the dose, the less side effects. Um, so I see a lot of my clients do really well with like everyday Cialis because it's 5 milligrams instead of 10 or 20 milligrams, and so there's less. The most common side effects that come with those kinds of things are like foggy head kind of stuff or mild headaches. So the everyday Cialis is great because now we're talking about pretty darn small dose that not very many men have those kinds of side effects with. And then men don't have to think about when they're going to have sex. And they don't have to decide if they want to spend, is it worth it to spend $25 on a pill? Well, what if we don't have sex and then I wasted $20, right? Or, all that kind of stuff. And then the other thing that happens too, and one of the reasons I like everyday Cialis is that it's, couples can have spontaneous sex when they want. And they don't have to worry about the whole planning thing around pills. So that's,
So
that's,
this would be pros of Cialis versus Viagra, is what you're saying.
yeah, Cialis is it's a newer drug. It lasts longer in people's system. So what I see is most of my urologists actually will prescribe, um, I have a plethora of urologists I work with here that are specialists in men's sexual health, and the prescriptions I see them making most of the time are everyday Cialis. That's the most common prescription I see for this.
Okay.
Um, and then we can escalate the invasive nature from there. There's pumps. That's not really invasive, but that is one of the medical kind of device things that do help some men. There's pellets that can be inserted in the urethra, more invasive. They work. And then, one of the things that men can do that almost always gives an erection are shots. And, men hear that and they kind of cringe, like, you're not giving me a shot in my penis. But it's, truthfully, and we see this with like diabetes patients, we see this with cancer patients. Sometimes that's what's needed. And so the process is really pretty simple. Your urologist has a specialist that actually does this all day long and sits with the male client, teaches him exactly how to give himself a shot. He gives himself a little shot in the penis. They're little itsy bitsy bitsy skinny tiny needles. And, it's scary the first kind of time or two. And after that, it's pretty easy. It's not reported as being real sexy, but it works. And then they can always do implants. So like those are like, but now we're getting into the way more invasive things. And fortunately for most men, they don't need to go to that extreme.
Yeah, and could you just give a brief description of some of these things that I know you and I are aware of, but like a pump, how does that work? This pellet, and maybe the you did a good job with the injections. What about the implants?
Yeah. So the implants it's a surgical procedure, and a man can actually kind of pump himself up, if you will. It's kind of like blowing up. It's kind of like blowing up a balloon or blowing up the tires on your car, and you just pump, 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 and up goes the penis.
Right.
And it works. I mean, it works up every time. So there's no pressure, but it's a surgical procedure. Some men too, by the way, need blood vessel surgery, right? If there's actually a blood vessel problem, so that's really invasive too. So it's not something we want to do unless it's last choice.
Right. Okay.
The suppositories that I was talking about are just it's called a prostatil, and it's just they're little tiny itsy bitsy suppositories that get inserted into the urethra, and doesn't sound
by the client themselves, you're saying.
right,
Mm-hmm.
right, and it works,
Yeah.
and it's all okay. It's like if that's what your doctor says you need is what's going to get you the erection you want. Maybe you really got to give that some consideration and try not to be a baby about it.
Right.
That's not gonna. So, it sounds scary, but it's not as bad as what it sounds.
Well, and even going back to, your comment that this might not sound very sexy, but, who would have thought that, back just even in safe sex education, let's go back to just putting on a condom, for example. What, that doesn't sound very sexy. In fact, that's usually a complaint I hear from a lot of people. Oh, it kind of kills the mood when you have to stop and put on a condom. And yet, the media is doing a somewhat okay job of every now and then now showing that this is part of sexuality, and that, again, the power of the reframe, that this can be part of our sexual experience, that we can pause and, get this tool out, or get this, vibrator out, or get this condom out, or get this pump out, and incorporate it into our sexual encounter so that it's not seen as interrupting the sexual play, but becomes part of the sexual experience, and that it can become eroticized.
Yeah, you said it so nicely, and it's so true, right? Because what happens if we can move away from like the medical piece and move it into the sexy erotic piece, then it is something a couple can do together.
Yeah, and that just takes practice with our psychology, right? Of telling ourselves this is okay and this is part of being sexy for us, and doesn't mean I'm broken or that I'm dysfunctional. Just it's part of what we're about now.
Yeah, I mean the truth is, sexy is what we tell ourselves, and if we can tell ourselves stories that feel sexy, we are sexy.
Yeah, I really like that. Well, we're right about an hour of your time that I've taken. What would you say are maybe some things that we could finish this discussion with? What am I leaving out, or anything that you'd like to add as far as either issues around why ED occurs or how it's treated, or things that can be helpful for people to reframe, etc.?
You did a great job, I think, of covering all the basics and a lot of good in-depth stuff too. I guess a thought to leave people with would be that if their belief is that they're going to have erection problems, then they probably will. So let's work on changing the belief to I'm in the process of getting help. I'm in the process of enjoying sex. I'm in the process of working on things. Because if you have that as your belief, you're going to have positive, good feelings. If you have good feelings, you're going to have good thoughts that support good sex. You're going to have more sex because you're going to be willing and wanting to do that. And then at the end of the day, if you do all those things, you're going to have better results. You're going to have better erections. So it really all starts with a positive belief.
Yeah, the power of positive psychology. I agree. And not always does just positive thoughts lead to things, which is why there are medical interventions and things, but it's a great place to start. And we do have a lot of power within how we frame and approach our relationships and ourselves. So thank you so much, Dr. Cannon. I really appreciate your time. It's been so valuable and useful.
You are so welcome. You are an amazing host. And it was great to be with you and your audience. And I'm just real grateful to have had this opportunity. So thank you.
We took the long road home, turned minutes into miles, and as the evening traveled traveled on, the sunset bathed your smile. We stopped beneath the desert stars, wrapped in each other's arms. Was as simple as I love you, an ordinary, extraordinary truth.
It's been a long road here, a trail with tears, pain and sorrow too.
But through every storm we traveled on, like lovers do. And if sometimes we fell apart, we always came back home. Was as simple as I love you, an ordinary, extraordinary truth. Some people say love is blind and forever is too long. But I see your eyes in every sunrise. Can't imagine life alone. Let's take the long road on together until we're gone. Want you by my side till the day I die and into the beyond. It's as simple as our love is. That's how I wanna go, all wrapped up in the arms of our extraordinary, it's nothing ordinary love. Ordinary. No, it's extraordinary.